presentation this morning, you spoke about a high-protein diet. Can you sum up a few key points from that presentation, or key highlights from that presentation?
Right. Well, certainly we know that protein is an important nutrient for human health. It's often been underestimated insofar as how much protein we actually need. And there are good reasons why eating more protein is particularly important if we're trying to control weight. And the most important aspect of that is the effect on appetite regulation. Having more protein does suppress appetite. For a relatively short period, it's a relatively subtle effect, but certainly having protein at each meal can reduce caloric intake, and that has been shown to occur both in the short term and in longer term studies.
So what is the role of a high protein diet or high good protein diet in patients with type 2 diabetes or those suffering from the metabolic syndrome?
Mm-hmm. In particular, obviously the importance with helping to reduce weight, but there are other metabolic benefits. One of those would be that a higher protein diet is generally lower in carbohydrate, and that would be associated with a reduction in triglycerides, which is one of the features of the metabolic syndrome. Secondly, the effect is on body composition. There is some evidence that people with type 2 diabetes require more protein because they appear to have greater protein catabolism, particularly if their diabetes is poorly controlled. And high protein diets in people both with and without diabetes has been shown to improve body composition and is associated with a reduction in abdominal fat mass.
Right. And you also spoke about gender differences. So the effects of a high protein diet in men and women. Can you elaborate on that?
Well, the amount of protein that one needs is a function of how much lean mass we have. And in women, you don't have to provide them with as much protein to achieve the benefits. In men, you do have to increase the protein above a gram per kilogram of body weight per day to see the difference. And when we have undertaken studies in men, if we do get the protein above let's say 120 to 130 grams of protein per day, you do see a significant reduction in abdominal fat mass compared to a high carbohydrate diet.
Right. And what about protein timing? You mentioned about that as well.
There are some researchers that believe that the timing of protein is important to achieve the impact on body composition, such that you need to have at least 30 grams of protein at a meal. And so some researchers believe that you should have 30 grams of protein at breakfast and lunch and dinner. In the studies that we've conducted, in general, it's difficult to achieve 30 grams of protein at a breakfast meal. It's not achieved with our traditional cereal and toast type meal, and we've loaded most of the protein at lunch and the evening meal, and yet we've still seen changes in body composition. So it's not clear to what extent the timing of protein is really important.
Are there further research looking into this? Is it worth looking into?
I think it is, because it's a question that's often asked, and if we really do need to concentrate on the timing of protein, I think it's important advice. But I do think that the definitive trial that demonstrates that timing is important is yet to be done. And given that protein is digested over several hours, I'm still yet to be convinced that the timing is really that critical.
For those suffering from type 2 diabetes, or even just type 1 diabetes itself and metabolic syndrome, are there any contraindications to having a high protein diet prescribed to them?
There can be some concerns, although nothing that has been described in the literature in relation to adverse effects. So in all of our studies, we've looked at the impact of high protein on renal function, and in people who've got relatively normal renal function, we haven't seen any adverse effects. We've looked at high protein diets in people with diverse ranges of renal function, and we've measured microalbuminuria, macroalbuminuria, and we haven't seen any effects of high protein diets to suggest that there are any adverse effects. We are currently conducting a trial in people with poorly controlled diabetes and renal function to see whether weight loss on a high protein diet has any adverse effects, and we'll know the results of that study in a year's time. But at this stage, with renal function, we've already heard that glycemic control is probably the major important factor in achieving better renal outcomes. So it's quite likely that weight loss, which can achieve better glycemic control, is going to have beneficial rather than adverse effects.
Will a patient see such benefits if they are not being controlled on such a diet by, say, advised by a dietitian? Can they do this by themselves?
I think anybody who has diabetes, it is important that they have their blood glucose levels and their metabolic profiles monitored by a physician. Certainly we have had a number of people in the community who have noted the benefits of a high protein diet, but I think anybody who has type 2 diabetes needs to be seeing their medical advisor on a regular basis.
And to sum things up, can you just tell us briefly what sort of research that your clinic or your research facility is looking at in this regard?
With regards to high protein diets, we're interested in the impact of high protein diets on energy balance. So we're interested in the effect that it might have on a range of different outcomes. But mostly we're interested in how these diets might be sustained in the longer term. So whilst we are interested in the metabolic effects, we're interested in how to communicate information to patients, how to best provide the information in ways that makes it easy for people to follow such diets in the longer term, because we know that we can achieve successful weight loss over 12 weeks to 12 months, but sustaining that weight loss requires ongoing support, and how to best deliver that over time is really one of the challenges that we face.
Thank you, Dr. Noakes.
Pleasure.